Strategic marketing in the Smart Chiropractor Show. This segment is when we get tactical and strategic around marketing in your practice. Today, we're going to talk about how you can improve your retention utilizing a new patient onboarding email campaign. That was a mouthful, but it is much simpler in practice. Here is the bottom line. Anytime a new patient comes into your practice, they are new. And think about the last time you went into a new business, and specifically a healthcare provider. There's a lot of potential fear, there might be a little confusion, and I don't know what's next. And the best thing you can do is through your onboarding in your practice, ensuring that you are guiding the path. As we look at StoryBrand, it's about being that guide, and this holds true for your new patients as well. The more that they understand not only why they're there, but the expectations of what's to come, the better your retention will be. And the same goes true with email onboarding. The reason why this is so critically important is all of us have dealt with staff turnover throughout time. It is painful and it hurts, and then you have to coach and train, and different people do things different ways. What if you were able to have every new patient onboarded in exactly the way that you desire, in exactly the same way? And email allows you to do just that. Now, the benefit of an email campaign is this is not that you or a team member needs to sit down and type it out every time a new patient comes in and remember on day 3 to send this email. A campaign allows you to do this absolutely automatically. It's what we do within Chiro emails, and our email onboarding template is one of the most popular a la carte purchases in the Smart Chiropractor store because many docs out there realize the importance of it. So you can pick up those templates in the store, or Smart Chiropractor members have it all built out for them and automated within Chiro emails. This is part of that smart patient journey, as Jason and I have discussed quite a few times, where you want to help move people from new patients to active patients to proactive patients. And new patient onboarding sits right at the beginning of that active care phase. They're coming in, they're excited, and this is your opportunity to set the stage to reduce fear, to reduce friction, and to proactively address the questions that they have around the care they're receiving. Better that you do that, the more that you do that, and the more consistent you are with that, the better your attention's going to be. Jason, new patient onboarding email campaigns, a lot of words, but I think the docs out there understand the importance of this. What are your thoughts around this topic?
Well, you said it beautifully. Let's be clear here. We're talking about retention, which means people staying with your care longer. That is a very valuable part of the equation. If people stick around longer, you don't need so many new people all the time, and you can focus more on serving those that are there as opposed to introducing the new ones who are new. But retention is a byproduct of something. I've heard it said years ago that people will leave your practice for one of two reasons. Either their pain will go away and they'll say, "Thank you very much for your service, you helped me," or their pain doesn't go away and they will leave frustrated and disappointed. But the reality, in my opinion, beyond that conversation is that people will leave your practice for one simple reason, and that's because their expectations were different than yours. And so when you're able to articulate what people should expect when they are working with you so that they, as you said, proactively know what it is that they're getting into, what's expected of them, what's not expected of them, and what they should expect as far as symptoms or results or functional improvement beyond what they feel, then you are setting yourself up. More importantly, you're setting them up for success. But that only happens one specific way. Because every practice I've ever been into has been slightly different than every other one, it really requires you to lay out what your welcoming orientation, expectations, frequently asked questions, and guidance along the journey of getting started in your practice. Jeff mentioned there's 3 phases to the new patient journey. And some of this may be done for your potential new patients. That's the first one: potential new patient, active patient, proactive patient. And understanding that journey specifically is the first step in you understanding what should I be saying to each of those people during those different phases. Jeff said it. I'm just going to repeat it for the sake of making sure you really understand what we're saying. And that is that the reason most chiropractors don't do this now is not because it's not one of the best ideas you can probably implement in your practice immediately. It's because it's hard to do. And in fact, I would say it's impossible to do if you don't know the right technologies to use, number one, and two, what to say to each person during that phase. So what you would say to a potential new person, which would be somebody who's receiving your Research That Matters newsletters on a weekly basis, or your emails that go out inviting them to one of your weekly videos or webinars or podcasts or whatever you're doing to teach and invite consistently. What you are inspiring people to do, the actions they take and the ideas they focus on are 100% up to you to dictate, to share proactively. And the consequence of not doing that, of course, is they're going to come in with their own set of expectations, and they are probably different than what they will experience when they come into your practice. So it is one of the best ideas you can possibly implement, knowing the technology, Chiro emails being the best version of the technology you could ask for. There's others out there. And then two, knowing what to say and when to say it is essential. Of course, you get those templates already built into Chiro emails, which is part of Smart Chiropractor when you get there. But we are teaching you the concepts so you can decide, hey, you know what? I'm a do-it-yourself, or you can do it yourself. There are ways you can figure this out on your own. Others of you like to go where the gravity is, as they say, and move where it is easiest. We're happy to help you with that. But that is an essential strategic marketing tactic for you to be aware of, is making sure that when people come to your practice, they have a consistent welcome conversation. Again, Jeff mentioned it. Staff come and go. People have good days and bad days. People, oops, I forgot. I thought you wanted me to take care of that person, not make sure I said the same thing to every person who comes in all the time. Where you can automate this communication, the better, because the more consistent it will be. Email is one of those most important places to do it. Jeff, great job, man.
Thank you, Jason. Email, campaigns, and onboarding. These things go together. Docs listening and watching, if you do not have a new patient campaign built out, you can pick up the templates in our Smart Chiropractor store, or we're happy to do it for you as a member of the Smart Chiropractor. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.